Hi there, it's Justin Lubino with Senior Advisors, and this is our sixth weekly Facebook Live session where we're discussing Medicare question and answers. And today's topic is going to be, do I have to sign up for Medicare at age 65? So as we've done with the prior weeks, the first few minutes of the session will discuss the topic, and we'll open it up for live questions and answers throughout the video here. And so anyone that has a question can type into the window, and it can be any Medicare related question related to the topic we're discussing or any Medicare related topic. Before we get started though, we've been doing each week a quick trivia question. For the first one to be able to answer the question will get a $10 gift card either to Starbucks or Amazon. So today's question is actually not Medicare related, but it's actually one of the current themes out there is the World Cup. So for those folks that are watching the World Cup, the question for today is, who are the final four teams still playing in the World Cup for this year? So there's four teams remaining, and the first one to type in the correct answer into the window for the four teams that are still playing will win the $10 gift card for the first question for today. So we'll give it a minute here before we get started and give folks time to answer the gift card question. And you only get one answer in the window to see if it's correct. And while we wait for the answer, we'll go ahead and get started too on today's topic. So the question of, do I have to sign up for Medicare at age 65? It really depends on a few different factors. So there's something called the Medicare secondary payer rules, which basically says which insurance is going to pay your claims if something should happen to you. And if you are covered on a group health plan through an employer, it depends on the size of the company as far as whether or not Medicare is going to pay primary or the company insurance will pay primary. So, for example, for a company less than 20 employees, Medicare is going to be the primary insurance. So that means if you're working for a company less than 20 employees and you or your spouse is Medicare eligible, that you need to have Medicare Part A and Part B, because Medicare is going to be the first payer of your claims. So in that case, yes, you absolutely need to sign up for Medicare at age 65 if you or your spouse is working for a company less than 20 employees, and that's who you have your health insurance through. If you're working for a company more than 20 employees, then it's up to you. The group health plan could be primary insurance for you. So you do not have to sign up as long as the group insurance that you have is considered credible coverage, basically as good as Medicare, which most group plans would qualify as credible coverage. Then you can keep the group health plan as your primary insurance. So less than 20 employees, the Medicare is primary and you have to sign up, and more than 20 employees, it's up to the employee whether they want to stay on the group health plan or go get Medicare A and B. If the individual is qualifying for Medicare through Social Security disability, so in the first week we discussed the ways you could qualify for Medicare. If you qualify through Social Security disability after 24 months, the rules are a little bit different for Medicare secondary payer. Basically, if your spouse is working for a company of 100 or less employees, I should say less than 100 employees, then Medicare is going to be primary. And if it's more than 100 employees, then the group health plan will be primary. So these Medicare secondary payer rules are important to answer the question, do I need to sign up for Medicare at age 65? Again, it's going to be dependent on the size of the company with which you have your group health insurance. The other two scenarios are retiree health plans. So if you have a retiree health benefit from a company that you used to work for, and you're turning 65, then you absolutely need to have Medicare A and B as your primary insurance, because retiree health plans are secondary payers to Medicare. And the last scenario, which we're going to get into more detail in next week's session, is COBRA coverage. So COBRA coverage is when you've worked for an employer and you have health insurance through that employer, and you leave that employer. By federal law, you get up to 18 months of health insurance. Basically keep the group health plan. You have to pay the full premium, but that's what COBRA coverage is. It's essentially the same health insurance you had before you left the job, whether you retired or were laid off or whatever. It's called COBRA coverage. But the big difference is when you're on COBRA, it's secondary to Medicare, where if you're working for that large group, the group health plan is primary. You do not need to have Medicare if you're still working. But once you leave that employment, even if you take the COBRA coverage, you have to sign up for Part A and B of Medicare. So that touches on the main scenarios that we see for people asking the question, do I have to sign up at age 65 for Medicare? We're going to get into more detail next week on the COBRA trap for those situations for people that are on COBRA coverage or being offered COBRA coverage after the age of 65 and the implications it can have on those individuals. I had another case just last week where someone was going to be out of medical coverage for about 12 months with no options anywhere to buy health insurance due to that COBRA trap. So we'll talk a little bit more about that next week when we talk about the COBRA trap. So, but that's all we have for this week for the do I have to sign up for Medicare at age 65. We have 2 more sessions scheduled for the next 2 Mondays. Next week is discussing the COBRA trap, and for those folks that I just mentioned after age 65 that are going to be leaving their employment. And then the last week, which is 2 weeks from today, we'll discuss the Part D coverage, the prescription coverage with the Part D donut hole. So we'll explain how that works and answer any questions related. So if there's any questions out there for today, either related to today's topic or just in general, it relates to Medicare, you feel free to type in the window. We'll give it a minute or two here. All right. Doesn't look like we've got any questions out there for today's topic. So you're welcome to follow us on Facebook to get the invites for the next week's sessions. You can subscribe to us on YouTube. And we have about 20 videos out there right now, 20 plus videos related to different Medicare topics on YouTube. And we hope to see you again next week. So thanks for joining. Take care.